Welcome to Save Your Thyroid with Jennifer Holcomb, the podcast where we explore real stories, expert insights, and non-surgical options for treating thyroid nodules so you can make confident, informed decisions while preserving your thyroid whenever possible. In today's episode, I'm joined by Astra, a patient who underwent nanopulse field ablation, or nsPFA, a new non-thermal technique for treating thyroid nodules without surgery. Astra is here to share her experience with this innovative approach from diagnosis to treatment and how she's doing now. By the way, if you're enjoying this kind of content, please subscribe and leave a review. It helps us reach more people searching for safe, effective thyroid preserving treatment options. If you're new to the concept of nanopulsed field ablation, I highly recommend checking out my earlier episode with Dr. Ralph Tufano, one of the leading voices in this emerging field. In that conversation, we break down how nsPFA works, why it's different from thermal ablation techniques like RFA, and what makes it such a promising option for select patients. I've linked that episode in the description below. I want to hear your origin story. So tell us, how did you even learn that you had a thyroid nodule?
So probably going back to 2019, I was in just one of my regular chiropractic appointments, and my chiropractor looked at me and was like, "Do you realize you have something going on with your thyroid?" I don't remember the terminology he used. And I was like, "No, I have no idea." So from there, I kind of went to my primary care, and he was like, "Yep, we need to send you to an endocrinologist." And that's where I basically started finding out about this. Watched it for about 4 years. In end of 22, along with my 3-month-old strapped to my chest, I went and saw Dr. Tufano, and that was funny. I went for the appointment not realizing he would need to do a scan.
Mm-hmm.
And I have this 3-month-old attached to me.
Oh.
And I'm just like, "Oh, sorry, this is awkward," which is awkward seems to be my middle name. But that was fine. And at the time, it wasn't really bothering me.
Mm-hmm.
Roll forward to probably spring of 24, and I was meeting with my endocrinologist at the time, Dr. Aaron, and he was like, "If you're starting to get some kind of choking, you probably just need to make a decision. You either need to do a thyroidectomy, or you talk again to Dr. Tufano and talk about RFA." When I met with Dr. Tufano, he definitely talked about RFA, but he actually suggested nsPFA. And
Mm-hmm.
I'm really glad he did. Super glad he did, because it's a great experience.
Wow, that is so cool. And I just want to stop right there for just a moment and say your origin story and mine are so similar that it's crazy. I had my nodule kind of popped up unexpectedly at a OBGYN visit. And it was the same kind of thing where it was like, "Oh, I think you have a nodule or something. There's a lump in your throat." And I
Mm-hmm.
was like, "Really?" Because I had no symptoms at that point.
Mm-hmm.
But then over time, it got bigger and the symptoms developed. And pregnancy can actually cause nodules to grow, the hormones that we have during pregnancy. And so over the years, I monitored it. It just got bigger and bigger and bigger. And part of that time I was pregnant. And I hear this a lot from patients. Like, we have very similar common threads in our stories. So, okay, so you had this discovery. Now, remind me, did you say you had any symptoms eventually when you made the decision, or was it just, I need to deal with this before it gets any bigger?
Yeah, last spring I was starting to notice, like I was
Okay.
in quite a lot of Teams meetings, and I was starting to see when I was swallowing, there was this huge like movement. If I, as we're recording, you can actually see if I do swallow, you will still see a slight movement when I
Mm.
swallow, but it is, oh, it's so so much less than it was.
I
Like
don't
I
notice
was,
anything. Your neck looks wonderful.
oh, it's kind of down this side. When I do swallow, you probably will still see something. But last year, what are we, June? It was probably a full 12 to 15 months ago. I was on Teams meetings all the time, and
Mhm.
I was like, "Oh, I can even notice it now," when
Mhm.
I swallowed. And I was starting to notice I would drink a drink and I would choke, like you kind of like, when like water gets stuck on your windpipe, that
Yeah.
kind of feeling. And it was happening daily.
Oh,
And
that's
so that's when I was
terrible.
like, "What is this?" And they did the ultrasound, and they were like, "You're up to almost 11 centimeters." And
Oh
I was,
my,
yeah,
that's very large.
yes, I'm down.
Wow.
I mean, my highest measurement was 10.83 centimeters right before the procedure. Yeah.
That is very large. So, just to kind of give some perspective from my own experience, my nodule was 75 mLs. It was roughly 4.5 centimeters wide, which is
Hmm.
about as wide as a golf ball.
Hmm.
And then it was probably, I want to say it was between 7 and 8 centimeters long. So mine was originally a bunch of smaller nodules, and over time they fused into one. But I was told, and I've interviewed hundreds of doctors over the last 6 years.
Yeah.
I've been told by many doctors, oh, this thing is so big, you probably would have just not, you should have not had RFA. You should have had surgery. And you're really not a good candidate for RFA because your nodule's so big. And yours, you just explained how big yours was even bigger. Like, wow, really, really, really big. So 11 centimeters, that's like that.
It's, yeah, it easily encompassed this whole area here.
Oh
Yeah.
my goodness. So no wonder you were having that sensation
The
when you were
choking.
drinking water.
Yeah.
Wow.
The
Did you ever have food get stuck?
No, I never had food get stuck. It really was just on drinking. And then, I mean, I don't even think it was never uncomfortable to sleep or rest or lean on it. Never had any issues with it. It was purely the choking. Obviously, them telling me it got up to like 11 centimeters. I was like,
Mm-hmm.
fun. And this was probably in the June or the July of last summer.
Okay.
And then I had the procedure at the end of September because I had to figure out like extra biopsies, time off work. I had to arrange it around a work project. So I ended up having the procedure, like I think I've got my notes written right here. It was 3.55 by 5.49 by 10.83.
Wow. So
So it
yeah,
wasn't even small on the other directions. And I
yeah.
want to say it's in the region of about 7 nodules. I know one was on the right and then the rest were on the left. And you'll see as I swallow when we're talking, you will see a slight marking there as I swallow, but not when I'm just sitting.
Mm-hmm. Okay.
So
So the width was about the same as what I had, the golf
yeah.
ball width, but then it was very long. So I would maybe venture to guess that originally yours may have also been multiple smaller nodules that fused together over time. That's
Yeah.
actually what I'm told is it's very common. What about your thyroid function? Because commonly patients with thyroid nodules do not have issues with thyroid function.
Right. Same again. Like I didn't have any issues with the thyroid function.
Hmm.
I think back around 2020, 2022, my chiropractor had me take a couple of vitamins. I only remember it as the little white pill at this point. I can't remember what it was now. And then when I was pregnant with Zoe, was it my OB, my endocrinologist? I forget which one. One made me see the other.
Hmm.
And they actually put me on a low dose of thyroid medication just daily. And then about 2 months after she was born, he was like, yeah, you don't need this anymore. It was purely to support her growth of her thyroid. And I was like, interesting, because while I was pregnant and taking the medication, I was finally not cold. I was like, oh, I'm actually like a decent temperature.
Okay.
And then when I got off the medication, I got back to my standard, which is sitting in a sweater all the time. So always cold.
That's interesting. I wonder if maybe you're subclinical hypo, like you're just barely under the threshold, and pregnancy causes your body to have so much more demand on it. And so
Yeah.
during your pregnancy, you probably really needed that extra thyroid hormone. And like you said,
Yeah.
for her development, it's very critical for
Yeah.
fetal development to have adequate thyroid hormone. Wow, that's so
Yeah, I
interesting.
remember my bloods never being an issue. The doctors were always happy. The doctors were never concerned by my bloods. They were always like, your bloods are absolutely fine. Your nodule didn't really grow until like that last year, sort of 23 to 24.
So you had your consult with Dr. Tofano, and he suggested RFA and nsPFA and let you choose, or how did that conversation go?
Yeah, so obviously I met with him back in 2022, and I never went anywhere with it. I just kept monitoring it.
Hmm.
Life got busy. And then it was because of the symptoms that I was like, Dr. Eshwaran was like, no, go back to Tofano and make a decision. So
Yeah.
then I met with him with the guidelines from Dr. Eshwaran that I was looking at RFA. Like I didn't even know about nsPFA at that point. He basically suggested it. He was like, well, we have this new treatment. It seems to be quicker healing. It was a full $1,500 cheaper to do nsPFA over RFA. And he's like, the results we're seeing so far is you're up and about within 24 hours. And I can attest, like, I didn't take any Tylenol after, like I took it when I went to bed that night of the procedure. Next morning, I didn't need anything. I was like, I'm fine. Even just leaning on my pillow, like probably 24 to 36 hours. I had no issues leaning on a pillow or anything like that. The first day was definitely uncomfortable. But yeah, he suggested it and let me make the decision. At the time, I had great insurance, and I was actually convinced they were going to pay. And they did. I don't know what you've seen of the Facebook chats on the group, but they did actually end up paying after an 8-month claim with an appeal. So I was really grateful for that.
That's
Um,
incredible. Yeah. I know insurance has been a real conundrum for a lot of patients recently because at the beginning of 2025, we actually had a code released, a billing code
mhm,
for RFA by the Center for Medicare. So everyone was kind of waiting with anticipation for that, thinking that once that happened, we were going to start seeing all RFAs covered by insurance. And
mhm.
that's kind of been not the case. We've still seen a lot of patients who are getting denials. And I think that that's just because insurance companies take time for them to revise their policies and make adjustments. So just because the code's there doesn't necessarily mean insurance will cover it. But you
Right.
had your procedure done in 2024 before that
Yes.
happened.
Yes.
So at that point in time, it was still kind of a who's reviewing your case. All kinds
Mhm.
of variables come into play, and there's really no predictability as to what patient will receive coverage and what patient won't, or even what insurance. So it's been really kind of frustrating for a lot of people dealing with that. But I'm so glad that you got yours covered, especially because nsPFA is a newer procedure and there isn't a code for it yet, like there is for RFA.
Yeah.
That's incredible. So let's
Yeah.
talk about, before we get into the actual procedure itself, why did you decide to do a non surgical procedure instead of surgery? What was your motivation for
Yeah.
that?
My motivation was I didn't want to be on medication the rest of my life, truly. And also, I didn't really fancy a scar right there. Sorry, that's a very British terminology. But I remember meeting with Dr. Eshwaran back in the spring of 24, and he actually had a scar.
Really?
And I hadn't remembered that from meeting with him. And I just happened to ask, I was like, oh, did you have something with your thyroid? And he said, yes. Obviously, he couldn't share what it was,
Wow.
but he said he'd had a partial thyroidectomy. And so I remember seeing that scar, going to the meeting with Dr. Tofano, him giving me the options and basically saying, well, RFA is thermal, nsPFA is non-thermal. So there's far less risks. Like there's literally no damage to surrounding tissues. So when I walked out of that meeting, I was like, all right, if I can get an nsPFA, I will.
Hey, just a quick break to share something I'm really excited about. My brand new website, saveyourthyroidwithjen.com. You can head there to subscribe to my mailing list and stay in the loop about new podcast episodes, videos, and updates in the world of thyroid nodule care. And I'm now offering something new, one-on-one patient navigation services. If you're feeling overwhelmed or unsure about your treatment options, I'm here to help. As a patient who's been through this myself and spent years learning from some of the world's leading experts in thyroid nodule treatment, I can help you make sense of your choices and feel more confident in your next steps. You can learn more about patient navigation and everything else I'm working on at saveyourthyroidwithjen.com. Now back to the conversation. Let's talk about the actual procedure itself.
Mhm.
So, for people watching this who've never heard of nsPFA, it's a procedure that's done in the clinic. You're not put to sleep, it's not surgery, and they use a probe in the neck with ultrasound guidance.
Yeah, so when I went in for my appointment, obviously, I think I was the 15th patient for Dr. Tofano to have this done. 15th or 19th, I forget now, so don't quote me. But with the procedure, obviously, you had Dr. Tofano, you had his assistants, his nurse, and then there was 3 or 4 reps from the company
Mhm.
that were in the room. Obviously, laying out on the bed, and then he administered lidocaine in several areas. I would say that the pain of the lidocaine, as with all things like that, honestly, that injection was worse than any of the needles with the procedure from a pain perspective, because nobody likes having any needles.
Well, and that
I,
lidocaine injection kind of feels a lot
it
like a bee sting.
it does. That's true. It does.
Yeah.
I didn't think
And
about
so
that.
that initial sting is kind of a
Hmm.
shock to your system, and then the
Yep.
lidocaine starts to take effect, and you really can't notice anything after that.
Exactly. exactly. But yeah, it did the lidocaine and then waited the right amount of time and then got on with the procedure.
And then, so with the procedure, the placement of the probe is done after the lidocaine. So they insert the
Yep,
probe into the neck. And
yep.
then when they start the actual procedure, talk about what that felt like, because I've heard that there's something a little odd about it that's a little different from RFA.
Right before the procedure in the waiting room, when he came in to introduce everybody, they actually had me put a TENS machine on my neck. And then tested the TENS machine and was like, okay, when you have the procedure, will you let us know how does it compare with the TENS machine? And he's like, I'd like you to try and turn the TENS machine up to the maximum level that you can stand. And then when in the procedure itself, once they've put the probe in and everything, and they start the 8-second intervals, because it's very short intervals that they do,
Mhm.
I will say that what you feel, it's kind of like an electrostatic shock feel, kind of like when you touch the electric fence at a farm when you're a kid and you're playing
Mhm.
with the electric fence. It's kind of like that pulsing that you get with that. But it does reverberate. Is that the right word? It can go down your arm or it can go down to your diaphragm. So I definitely, at portions of the procedure, the pulsing that you got in the neck, you could feel in other areas. So that was, most of the time it was pretty bearable. It was absolutely fine. I think the worst part of it was probably about 2/3 of the way through when he was working on the front part of the nodule.
Yeah.
That one I definitely had to count through. May have said a couple of choice words. Again, apparently in a British accent, it just sounds very funny. And I definitely entertained Dr. Tofano because he's been to England a few times. So
Yeah.
he was talking to me about England to try and distract me. So it was actually quite funny.
Just to give the viewers a little understanding of
Yeah.
comparison, with RFA, what the probe is delivering into the nodule is heat.
Mm.
So the patient really doesn't feel anything except for maybe sometimes a little bit of warmth. Or if it's in a sensitive area, like you mentioned, towards the front, it might be a
Mm-hmm.
little more uncomfortable, but it would
Mm-hmm.
be almost like a soreness or a, some people comment about pain in their jaw or their ear, or kind,
Mm-hmm.
I had it actually kind of going down into my shoulder. But with the nsPFA delivering this electrical pulse, like you were
Mm-hmm.
saying, what I've been told is that it's kind of like sensation of almost kind of like muscle twitching or jumping.
Yeah.
You
Yeah, I
mentioned
would
with
agree
the
with that.
TENS unit.
Yeah.
What I've been told is it's not necessarily painful. It's just very
Mm-hmm.
kind of unsettling for the
Yeah.
patient. Would you say that's
It's
correct?
slightly unusual. Definitely at certain portions of the procedure, it's more unsettling than not. Does that make
Mm,
sense? Majority of the procedure, though, I would say it was fine. You're just kind of getting used to it.
yeah.
And you're just kind of like, oh, that's weird. But it's nothing, for me at least, it was nothing anxiety driving or driven. There was no sort of nervousness that came from it. Does that make
Okay.
sense?
Yeah, yeah. I actually meant to ask you before the procedure, were you given anything for anxiety, like a
I
medication?
I was offered, but
Okay.
I chose not to. I was like, no, I think I'll be fine. I did a few things with the procedure. Like I actually drove myself to the appointment. Probably wouldn't recommend that. I don't know whether I fully understood the procedure or what it was going to involve or how
Mhm.
sore my neck would be afterwards. Obviously, with my daughter at daycare and my husband at work, I just kind of was like, oh, I'm fine. As you can probably tell, I'm quite independent. So I just drove myself to the appointment. And then afterwards, I was like, oh, yeah, that wasn't a good idea. But drove myself home whilst having my best friend on the phone, just so I was like, hey, can I chat to you for 20 minutes while I drive home? So
Yeah.
yeah.
So was the experience of driving home just kind of uncomfortable, turning your neck and things like that?
Yeah, it just basically would mean you have a very, very stiff neck. It's not
Mm.
impossible to turn, but obviously looking in your blind spot is
Yeah.
a little tougher. I had to drive on the freeway as well, so
Mm.
I stayed in the slow lane and just stayed at like 65 to 70 and
Mhm.
didn't push anything.
Yeah. I remember the day after my RFA procedure, I was pretty sore.
Yeah.
And having a larger nodule also
Hmm.
does make a difference. For the
Hmm.
patients who have really tiny nodules, they say, "Oh, I wasn't sore at all the next day or even the day
Nice.
of." But those of us with larger nodules, there's more trauma to the neck, and so it can feel a lot sore. And so with my procedure, so I actually had to go out of state for mine. Back then, there weren't as many doctors doing RFA. And so we were 9 hours away from home. And the next
Oh,
day, I
wow.
told my husband, I don't think I can handle the little bumps in the road all the way home for 9 hours straight. So we actually stayed an extra day. So, how lucky for you that you live really
Yeah,
close to
just 40
Sarasota.
minutes from the office.
That's wonderful. How lucky for you that you have a physician in your area doing these procedures. That's so cool. So you had a little bit of an uncomfortable drive home, but the next day you said you
Absolutely
didn't
fine.
even need Tylenol?
No, didn't even need Tylenol. I was using arnica cream just because I know it's anti-inflammatory.
Mhm.
And obviously with putting that on, like I was loading it on, like
Mm.
obviously I had the red mark. Yeah, I took pictures for about 36, 48 hours. And then after that, I just forgot. But my 2-year-old was like, Mummy's got a boo-boo. It was actually very cute.
Yeah.
But for the next day, the redness came out pretty quick. And obviously for about a solid 24, 36 hours, I was just layering the arnica
Yeah.
cream on there, which actually really
Wow.
helped it.
Wow, that's
Yeah, really helped
awesome.
it.
Yeah, I've heard a lot of patients say that in the community on Facebook. Viewers, if you're watching this and you don't know what I'm talking about, we have a Facebook community called
Hmm.
Save Your Thyroid Non-Surgical Nodule Procedures. That is a community of over 13,000 patients who are interested in saving their thyroid with FDA cleared non-surgical procedures. We don't talk about lifestyle there. We just talk about the procedures. That's a really great community for you to connect with other patients and hear their experiences and learn about their doctors and all kinds of other wonderful pieces of information that the patients in our community share. So go join that community if you want to learn more from the patient perspective. Now, let's get back to your recovery process. You had the next day, no pain, and then over time, there's this reduction that takes place. It's not an immediate reduction, but what I'm told is that with nsPFA, the reduction is quite rapid in
Hmm.
comparison to other non-surgical procedures. So tell us about how quickly did you notice that bulge in your neck start to disappear?
I will say that probably within a day or two of the procedure, I didn't choke on water again. And that was probably my biggest revelation because it wasn't until about the first appointment, which was 3 weeks. It should have been 2, but it was 3 weeks later. Dr. Tofano asked me, he's like, so have you been choking on water? And that was when I went, you know what? I don't think I have. Like, and that was the biggest revelation for me. At 3 weeks, I had 62.5% reduction. At six
Wow.
weeks, I had 70% reduction. And then at 3 and 6 months, we've kind of leveled out at 72% reduction. So I'm down now to 2.58 by 4.12 by 5.55.
Wow.
So we're well under half. Which at
Amazing.
my follow-up appointments, Dr. Tufano is like, oh, there are a few more nodules there that we couldn't get to in the original one because your nodule was so large. If you do want to do it again, you could. But if it's not bothering you and there's no like changes, obviously we'll monitor it over the next however long.
Mhm.
But at 72% reduction, I'm over the moon.
I can relate to that. I was the same with mine reducing. I want to say it was around 70 to 80% in the first year. And it,
Hmm.
it eventually, after my second, because I had a second RFA procedure, leveled out at 90%. And I've had that reduction maintained for the last 5 years, 6 years. And I'm elated. Even though I still,
Hmm.
like you, I still have a nodule there. I don't notice it. I can't
Hmm.
feel it. I don't have any
Hmm.
more of those awful symptoms, the choking you mentioned.
Hmm.
I was living with that too. And that is a terrible feeling. And so that is phenomenal that you had that much of a reduction and that quickly, because it took me the better part of a year to reach that amount of reduction. And you had that in just a few weeks. That is incredible. When you went for these follow ups and these appointments, what was Dr. Tofano saying about your reduction in comparison to other patients he was treating?
He was very pleased with the reduction. I even went home at New Year's, which was about 3.5 months after the procedure, and even my family commented on it. And so when I actually told him that, I was just looking at my notes before this meeting, and he actually wrote in my notes. She went home to see her family, who all commented on how good her neck looked. Which was really funny. So he's been very pleased with the reduction. He did say that I think I had 93 cycles of the 8-second intervals. He did say that was a lot. I think the most he's ever done was about 120 at the time, but majority of people are just between 30 and 60.
Mhm.
So he did say I had a lot of cycles of it obviously get the larger nodule. So he's been very pleased every time I've gone back.
Wow. Let's see. You had your procedure a year ago.
September, so about 9 months ago.
Almost a year ago. So are
Yeah,
you going back in September for a 1-year
I
follow-up?
will.
Is he anticipating any further reduction, or is he expecting it to be kind of stable by now?
I did message the office probably about a month ago because I was like, oh, I don't see, because when you asked me for the meeting, I was like, oh, what were my measurements at 6 months? Because I don't see it in my notes.
Mm-hmm.
And the response was, it was about the same as 3 months, just
Mm-hmm.
not very much change, but we'll check again in September. So I would hazard a guess it's probably going to level out now. I don't see it changing all that much. I would be curious actually when I go for that appointment. I'd be like, no, can you really tell me exactly what it is? But I'm super happy with that. Obviously, after that appointment, I'll get discharged from Dr. Tufano and I'm actually going to change endocrinologists because the doctor that did the biopsy prior to the procedure is also in Dr. Tufano's office, Dr. Baldo, and she is incredible, super friendly. Dr. Tufano is. So I'm actually going to see if I can switch to her.
Oh, that'll be wonderful. You'll still be right
Yeah.
there too if you ever
Yep.
need him. Do you think you're going to have another nsPFA procedure in the future, or are you going to just keep rolling with what you have?
I think I'm probably going to keep rolling with what I have. I don't think I need to get it down any less. I mean, it's not noticeable. I mean, if I really look when I'm swallowing on a Teams call, I can see it, but it's not bothersome. Do you know what I mean? Whereas
Yeah.
before, I was really kind of like, oh, that's really getting quite big. So I'll probably just roll with what I've got pending changes in
Yeah.
whether blood or symptoms. And at that point, I'll probably reevaluate. But I definitely would have an nsPFA again.
Wow. Tell me if you could do this for me in September after you have that appointment.
Yeah,
Do you mind coming on YouTube and commenting under this video what you find out?
sure.
That would be
Sure,
fantastic. I know
absolutely.
the viewers are constantly asking me underneath videos, well, how's this patient doing now? So I know they're
Yeah.
going to want to know how you're doing. That's really wonderful. And then what do you think you would say to somebody who's thinking about doing this? What advice would you give to them?
I would highly recommend it. For me personally, I was driven because I didn't want the thyroidectomy and because there was absolutely no risk to surrounding tissues. And the fact that I can keep my thyroid, I was like, no, if we don't have to have it removed, let's
Yeah.
go with whatever procedure. And I really didn't mind being within the first 20 patients that Dr.
Yeah.
Tufano had. I looked at who he was, I looked at his history, I looked at his ratings, and just the way he carries himself, like he is super knowledgeable. Most people in the Facebook group are probably going to get sick of me because I'm like, guys, if you can get to Tufano, like I think I commented on a post the other day to a girl in Australia, and I was like, if you don't mind traveling and paying 4,000, because I would hazard a guess they don't have the insurance that would cover international treatments,
Mm-hmm.
do it. It's worth the
Wow.
4,000. Like obviously if the procedure was 40,000, that's a different story.
Right.
4,000 is kind of manageable, I would hope,
Mm-hmm.
for most people. It's not an impossible task to
Yeah.
get to, so I would recommend it highly.
Well, and a lot of patients even say, the out-of-pocket cost is worth it when
Hmm.
you think about the long term, what you're gaining in the long
Yep.
term.
Yep.
You're not losing your thyroid, so you're not going to have to go on medication, and you're going to have all of the things that would be lost if you lost your thyroid
Hmm.
preserved. So it's not
Hmm.
just about saving your
Yep.
thyroid, is not just about saving the thyroid gland. There are so
Right.
many things in our health that are connected with the
Hmm.
thyroid. I'm 42. I'm in the throes of perimenopause, and for the past year and a half, I have found out how interconnected our sex hormones and our thyroid hormones
So
are.
connected.
They're so related. And if your thyroid is struggling, all of those female hormones are going to struggle and vice versa. And so that's so crucially important to consider when you're weighing the pros and cons, the cost versus,
Hmm.
oh, a thyroidectomy is covered by my insurance is, well, yes, it is. But what other costs are you going to have, both monetarily and speaking of your health? There's so many benefits. And when you talked about the safety aspect, I want to talk about that for a moment because with these larger nodules, the thyroid is in the middle of your neck, and there are so many important things, critical structures in the neck. You have your esophagus and your trachea that everybody knows, where you breathe and where you swallow your food. but then you've also got all kinds of nerves. You've got the nerve that controls your voice, which also controls your ability to swallow. That's called the recurrent laryngeal nerve. You've also got the vagus nerve and the phrenic nerve, and you've got the carotid artery and the internal jugular vein. And all of these structures have to go through your neck. And if you are having a large nodule press on all of these, there's a little bit of risk for the thyroid kind of being close to things that you don't want affected by a thermal treatment like RFA or microwave ablation. And so it can be more risky for patients to have, like with my case, a very large nodule that's kind of impeding on all of these structures, and then the heat will travel through the neck into those areas. And so the safety of nsPFA is that there is no heat. There is no risk of damage to these other structures in the neck. And so I can see why Dr. Tofano recommended it in your case with such a large nodule.
Yeah.
So, wow, what an incredible.
Yeah, I'm really glad he did.
So we've talked through your entire experience. Was there anything that surprised you about this that you kind of weren't expecting?
I would say because of that, like halfway through the procedure, there was that pain when he moved to the front of the nodules. Now, obviously with the lidocaine, I was like, oh, it's going to be kind of like just going and getting a cavity done at the dentist. I didn't really understand how that could change. Obviously, so when he moved to the front nodules, and it was significantly more painful. Like, it was not only the pressure, but it was painful. And I did have to count through the 8-second intervals. I will say that sort of going through that portion of it, when I got to the end of it, I was like, oh, I don't want to do that again. Now, talking about that, I wouldn't want that to scare anybody, because I'm pretty certain, because he definitely mentioned that they were talking about doing more sedation, offering more things to help. So I wouldn't let that put anybody off of nsPFA. But I would want to say, like, yes, there is a portion of it if your nodules are at the front and things like that. Be aware of that. So that one definitely caught me slightly off guard. And obviously you're laying down, I think, all in all, I think I was laying down for about an hour and a half. So obviously when you sit up, you are sort of like, you sit up slowly, the nurse is with you, she's giving you an ice pack and things like that. So I will say I was like, oh, I'm a little slower at getting up than I thought I was going to be. So I didn't have full understanding of what I was walking into, hence the driving myself to the appointment. But I would definitely recommend it.
So tips: have a driver, even if you think you're going to be okay and you're not going to take any anxiety medication, have a driver. I recommend that as well. And then also regarding the sedation point you mentioned, I've actually been told they're doing these procedures with the option of sedation, which in terms of RFA and microwave, we talk about patients undergoing conscious sedation, which means you're still awake and you're still alert and you're still speaking, but you're very, very relaxed, basically, and you might fall asleep or doze off, but you're not under like total asleep general anesthesia. But what they're talking about doing with nsPFA patients now is kind of like what you would have with a colonoscopy, where you don't really remember it afterward. And what I've been told is that for the patients that find the pulses a little bit too much for their anxiety, that is a very good option. And it's actually quite affordable and covered by insurance is what I'm told. So obviously everyone's insurance will be different, but we have experience with that in the colonoscopy sedation world, that a lot of patients have experience with as well. And so they know a lot of patients know what that is like. And so sometimes patients are a little uneasy about sedation, and then you tell them, oh, well, it's like this. And they're like, I think I can do that. So that would be a tip for patients as well. Astra, is there anything else you feel like we haven't covered that you want to talk about regarding this procedure, your experience, thyroid nodules, thyroid health in general?
I appreciate that looking back now, I can only kind of compare it. Well, I don't know if I should compare it, but compare it to childbirth. Everyone says before you go through it, they're like, you won't remember the pain afterwards. And true enough, you don't. With this, I'm actually, as we're talking about it, I'm going, you know what? I don't really remember the pain. I remember there being that moment of really not enjoying it and having to count through it, but I don't remember it. And it will let me look at it a second time around if I need it. I would definitely consider it.
That wraps up my conversation with Astra. Huge thanks to her for being so open and honest about her journey with nsPFA. Stories like hers are exactly why this podcast exists, to show you that there are options beyond thyroid surgery, and you're not alone in navigating them. If you're curious to understand more about the science behind nanopulse field ablation, I highly recommend you watch my previous interview with Dr. Ralph Tufano, where we dive into how this treatment works, who it's for, and why it represents such an exciting development in thyroid care. You'll find the link to that episode in the description below. That wraps up today's episode. If you found this valuable, please like, subscribe, and share it with someone who might benefit. You can find links to everything we discussed in the show notes below. Find a physician, discover treatment options, and join our patient community at saveyourthyroid.org. To stay up to date on new episodes, resources, and expert insights, be sure to subscribe to my mailing list at saveyourthyroidwithjen.com. It's the best way to stay connected and informed. There you can also find all podcast episodes and book a 1-hour patient navigation consult for personalized guidance on your next steps. As always, please remember this podcast is for informational purposes only and is not a substitute for professional medical advice. No endorsement is given or implied for any specific product, treatment, or physician mentioned. As always, consult with a qualified healthcare professional for your individual needs. Thanks for listening, and I'll see you next time.